Now a story that really caught our attention today. An Australian toddler is alive after a horrific car accident caused his head to separate from his neck.
Incredible. But thanks to what some doctors are calling a miracle surgery, the boy is already walking and the world is watching his progress. News Channel 8's Josh Benson joins us now with some local medical insights. Pretty interesting stuff here.
And big headlines on this story. A
all over
lot
the
of
place.
people are talking about it, as you mentioned. Well, many reports say that 16-month-old Jaxon Taylor survived an internal decapitation, as you can see from here. But that is a shocking diagnosis. But even more shocking is a local neurosurgeon telling us that those reports are misleading and injuries like Jackson's are much more common than you may think. Riley Taylor and her kids walked away from this head-on crash, but 16-month-old Jaxon had it the worst.
The second I pulled him out, I knew that his neck was broken.
Worldwide media reports have called Jackson's injury an internal decapitation. But Dr. Luis Rodriguez of All Children's Hospital in St. Petersburg says
this does not show a quote-unquote internal decapitation. This is a C1, C2 injury, a subluxation. It's still an injury that is very delicate.
In fact, Dr. Rodriguez says he treats 2 to 3 cases similar to Jackson's each year.
We fix these operations without having to put the patient in a halo, the great majority of times, without having to take the patient's own bone. We just use cadaver bone. Takes 2 to 3 hours to fix.
Dr. Rodriguez says he is glad to see Jackson's story out there. Not just the fact that he's recovering, but also how it's drawing attention to the health of children and the special delicate care they require in any medical situation.
I think it's hard for a lot of people to understand that children are not smaller versions of adults.
As for the Taylor family,
they've taken 2 broken kids and put them all back together, so we're very, very thankful.
happy to see him recovering. But Dr. Rodriguez says about 50% of children who suffer an injury like Jackson's do not survive at the scene of the crash. And if they do, many become paralyzed from the neck down in these cases.
It's just incredible. Is there anything that can be done to better a child's chance of survival from something like this?
Yes, and it's actually already happening. The doctor is telling us that part of the reason that these diagnoses are happening and these cases are becoming so successful is people are starting to understand what's happening at the scene. The first responders can determine, okay, that is an injury we have to look out for, and then they carefully transport those patients to the hospital. So seeing a lot more recoveries in this case.
Still a miracle to me when I see something like that.
Amazing
and I'm glad to hear that it's actually possible here locally, and they do 2 to 3 times a year.
You can't believe what they're doing around here. It's amazing stuff.
Josh Benson,
Thanks, Josh.
thank you for that story. All right, now